All right, welcome to Nurse Stories Live. I am Taylor Hayes Carroll. I'm here with Nurse Sherri Mack. She's here to share her story about healing with psychedelic and other plant medicines, and I can't wait to hear about all of her experiences. She has a extensive background of experience in nursing and healthcare and helping other people in podcasting and uh, just amazing work in the plant medicine space. So I'm going to open it up and let Sherri share what she wants to share, and I've got plenty of questions to ask for her.
Sounds good. All right. Hi, everyone. So, yeah, I always like to start off with, gosh, may the best version of myself come forth in this moment in time so I can reach the most people with what I'm about to say. I like to start that off. That's how I start my podcast off, just kind of setting the intention to let, my words flow out of me that have meaning and that you can all hear them. And I've been really fortunate to be able to experience a lot of these psychedelic medicines. Um, Gosh, I could create a slide deck on each one of them. As a matter of fact, we did write a program on introductory to psychedelics at Holistic Caring and the Green Nurse. And that was after years and years of working with them and experimenting with them and sitting in ceremony and working with a lot of people that have created the ceremonies and just learning. And so we created a program, Introductory to Psychedelics. But just to rewind back, my first time using substances was in college. First time using cannabis was in high school. I enjoyed it recreationally, but it wasn't my jam. I enjoyed partying here and there, but I really wanted to be a nurse. And my first time using psilocybin mushrooms actually was in college, and it was a recreational experience. Had a wonderful time. I felt like I was living my life as a cartoon. It's the best way for me to explain it. I didn't notice any medicinal benefits at the time, except for that I had no hangover, which was very interesting. So, because I just did mushrooms with my roommates one day on a Saturday, and we just enjoyed it and had a wonderful time. I did also experiment with MDMA one other time in college, and that wasn't so pleasant. I didn't really enjoy that in a recreational sense at all. I find that that medicine for me, is a little bit more private and more intimate. That's just my own personal experience. Um, but my experiences have been for healing mind, body, and complex trauma. So in 2012, cannabis came into my life when I got sick. I started my medical cannabis journey. So I've been a nurse for a very, very long time. This is my 37th year of being a registered nurse, which is just phenomenal. I can't believe I'm that old, believe it or not. But I've done a lot in my nursing career. I worked at some of the big teaching hospitals in Boston, Beth Israel Deaconess Medical Center. I had a 25-year career there, across multiple different disciplines, orthopedics, plastic surgery, infectious disease. I did intensive care nursing, emergency nursing. I was cross-trained in all the ICUs, loved that, did telehealth nursing. And then when I started to have my kids, I decided to move into more of the community-based nursing role. And so I became a visiting nurse, and I did home infusion and became certified in oncology, palliative care, hospice, end of life, and did a lot of home care environments. And then prior to me getting sick, I was a clinical nurse specialist and a liaison at three of the big teaching hospitals in Boston, working for a home infusion company, facilitating difficult discharges to help patients get home on very difficult therapies. And it was while I was working that I ended up getting sick. I got an infectious disease and I almost died. And I ended up in the ICU for about 6 weeks, and I had megacolon. My gut microbiome was wiped out. And I was one of those patients. I became a patient on the other side of the bed, where I had to delve into the world of pills and procedures and surgeries and medical appointments. And it was very, very daunting and very, very traumatizing. And at one point in time, I was on over 18 pharmaceuticals, which is horrible. So I don't know if in my plant medicine journey of becoming a cannabis nurse and being, a educator of psychedelics, polypharmacy is five or more pharmaceuticals. If you're on five or more pharmaceuticals, there's a 50% chance that they're interacting. If you're on 10 or more pharmaceuticals, there's a 100% chance that they're interacting and probably not in your best and highest interest. And that's where I was sitting at that particular moment in time. On 18 pharmaceuticals, I was a single mother of three, had three babies that I was taking care of. They were young at the time, and I was sick and suffering. And it was actually a nurse that came to my house that introduced me to cannabis as medicine. So I'm also an energy healer. I do Reiki. I'm a Reiki master. I do reconnective healing, and I love working with the Healy, which is a bioenergetic device. It has a quantum sensor, and it delivers frequencies and vibrations. So I'm into energy healing, and so this client of mine who was a nurse, a retired nurse, 70 years old, retired, was looking, for an energy healing session, and I was out of commission because I was so sick. And she came to my house and brought with me her garden harvest. So she brought a basket filled with topicals and edibles and a couple of cannabis joints. And, 70 years old, I'm like knocking on my door. Sherri, answer the door. I know you're in there, and you need to hear what I have to say. And so she basically came into my house, and I was kind of like, you're bringing me cannabis. I'm on the strongest pharmaceuticals. How and why could this ever work for me? And she says, Sherri, get with the program. She goes, it's 2012 now. Cannabis is legal medicinally. And she says, I'm sure it's going to be legal for adult use at some point in time. I don't know when. She says, but it's been around for years and years and years. And she says, I want to disclose something to you. I've been using cannabis. She goes, at the age of 70, I have been using cannabis every day since the age of 17. I'm not on any pharmaceuticals, and I've never been hospitalized. And she also disclosed to me that her father was a pharmacist and carried cannabis formulations in his pharmacy prior to 1937. So my cannabis journey began when it was a nurse that came to my house, and she had this transpersonal, beautiful experience with me, sharing, her garden and her harvest with me. I was sick and suffering. And basically, when I tried her goods that she brought, my pain went from a 10 to a 0 immediately. So that got me involved in cannabis right away. So I figured out how to make cannabis like work for me. I went and got my medical card. I was plagued with stigma. I was still very, very scared. I went to a different town. I put a hat on and gloves and scarves and dressed differently. I didn't want anyone to know. My mother wasn't very happy about me using cannabis as medicine. As a matter of fact, she blocked me on Facebook for a good year. And she was writing me letters, but I was getting better. I was healing. And slowly but surely, these pharmaceuticals were going away one by one by one. And before you knew it, I was pharmaceutical free, just using plants. But I still had more work to do. And how I knew I had more work to do is because I became very comfortable being alone. The pharmaceutical and medical trauma is real. I actually presented on that at the Cannabis Nurses Network back in 2020, and that patients get traumatized over and over by the system. One pharmaceutical, one pill, one procedure, no talking, insurance not being covered. I was traumatized by the system. And so I had to figure out a way to stay out of the system as much as possible. But the issue with staying out of the system as much as possible meant that I wasn't getting out and interacting and taking care of myself in a way that I needed to. So at one point in time, I got sick and I thought that I could handle it on my own and take care of myself using all of my little potions and lotions and herbs and all of the other, things that I had, and I didn't. And I ended up in the emergency room, and I almost got pink papered because I was in a dehydrated state. I had electrolyte abnormalities, and I wasn't thinking clearly. And so, that put me in a really bad place for someone that's already been traumatized. I was re-traumatizing myself, by not going and seeking care. So I had to, pretty much defend my mental health at that point in time, saying that I wasn't suicidal. I didn't, there was nothing in my system but cannabis. There were no other pills or anything in me, but they were concerned. And then I became concerned. And I had to really take a look at that And that's really hard to do, is to take a look at your own behaviors. And, what brought me into the emergency room was me not going to the doctor and seeking the help that I needed and thinking that I could do it on my own. So I decided at that point in time that I needed to really explore my mental health. And I've had a history of ADHD since I was a kid. I've had a history of anxiety as well as a kid. I'm also a child of, I would say, I wouldn't call it abuse, but there was some alcoholism, alcoholic behaviors in the family growing up, some dysfunctional family, as most people have, and so I literally needed to figure out a way. So I've always involved myself in mental health counseling. So I've had a cognitive behavioral therapist. I've always seen a psychiatrist because mental health is extremely important to me. So, it was interesting. My psychiatrist and therapist, bailed me out of the emergency room at that particular time saying, no, she is not suicidal. No, she's not trying to hurt herself. She's just severely traumatized and she needs to do more work. And essentially, that's what I did. And so I started to really look at more as how psychedelics could possibly help rewire my brain around the trauma that I experienced through the conventional system. And so that's what I did. Cannabis, um, medical cannabis journey started in 2012 when I got sick. Psychedelics as medicine started for me in around 2018, 2019. And I started, microdosing mushrooms and doing a mushroom journey and ceremony. I've also done some microdosing of LSD, and I've done an LSD journey and ceremony. And then, and that I found that to be helpful. I'll tell you, the substance that helped me the most was DMT, and we can talk about that in a minute. But I've also experienced ayahuasca twice with a facilitator in a ceremony, DMT 6 times in a ceremony. And then I've also learned ketamine. So I had an opportunity, a ketamine clinic was opening up called Keta MD. They're not open anymore. But it was a clinic that was available for patients and for nurses to actually guide patients on a journey. And then part of the experience as a clinician was that you got to experience the medicine yourself. So I had used ketamine in a way to learn about ketamine, and it was an amazing experience and had the ability to guide and facilitate sessions for some patients with this company, but they ended up running out of money and went under. But I found it to be very beneficial. So, the bottom line is how has psychedelics helped me, right? So you have to think about, for me, trauma is trauma, right? PTSD symptoms are on a spectrum with various levels of debilitating behaviors, unique to each person. And it is very soul crushing when you're doing all you can to heal and nothing works, right? So psychedelics actually helped me to process emotion around mind, body, spirit trauma and step into my authentic self to live my best life and become the best version of myself. The psychedelics helped me with self-acceptance, with self-esteem, following chronic debilitating illnesses. The experience of using psychedelics has boosted my confidence and helped me to redefine my relationship with all of my feelings, allowing them to move freely and gently, creating and expressing who I am. I have a few notes so I don't go over. Psychedelics have also helped me to heal relationships and to build better ones based on kindness, compassion, and healthy boundaries. Psychedelics have increased my compassion for self and for others, bringing more clarity on how my thoughts, emotions, and feelings have me act the way that I do. So very, very self-reflective tool, amazing for shadow work. Psychedelics help me to do the shadow work around trauma, crucial for my personal development to help me become the best version of myself. And I found psychedelics to be a transformational tool that opened up doors for overall wellness and helped me to look at root causes of past illnesses for healing and prevention. It wasn't easy, but it's totally worth it. And, the therapeutic use of psychedelics is the use of these plant entheogens for medicinal, wellness, and healing purposes. And it's particularly for the mental, physical, and spiritual health. And the entheogen is a psychoactive substance that induces the alterations in perceptions and mood, consciousness, cognition, and behavior for purposes of engendering spiritual development in sacred texts. So I took this in a very sacred way. My healing was very, very sacred and very spiritual. And so the therapeutic use of psychedelics is personal and subjective to each person that's using it, right? And so we need to think about, what does our objective criteria look like? Objective criteria looks like improvement in one of the five health domains without negatively impacting any of the others. So for me, pain-wise, it's helped with chronic pain. It's helped lessen the need for pharmaceuticals and side effects. It's helped with PTSD, anxiety, panic disorder, insomnia, agoraphobia. It's helped with emotional processing, better boundaries with myself and others. It's helping to open up my mind to explore and experience life with less fear, which is huge. And one of the things too that's really interesting is that I'm learning is that healing is not linear, right? There's always, every time you think you're healed, guess what? The universe is going to show you where you need to heal again. And so psychedelics are beautiful medicines to be able to help you to process emotions and feelings around things that are unknown. And so once again, I'm on another healing journey. Um, I don't, I don't have it in here. I have a cane. I'm walking around with a green cane right now. I got a blood clot this year, threw me for a loop. How the heck did I get a blood clot? I was exercising. My endocannabinoid system was top-notch healthy, eating, sleeping, relaxing, forgetting, protecting, taking all my supplements, not drinking alcohol, praying, meditating, doing all the right things. But then again, here I am with this big giant blood clot behind my knee. And so that really threw me for a loop. And psychedelics are facilitators for helping me to explore that avenue as well. And so I'm really excited to explore. I have a phone call tomorrow, as a matter of fact, with a company that is going to be doing a clinical trial on ketamine using a transdermal patch to manage chronic pain. And so what I have is, they're doing it for people that have chronic regional pain syndrome and other chronic pain issues. So the kind of chronic pain that I have now is called post-thrombotic syndrome. Who the hell has ever heard of that? Right? Post-thrombotic syndrome. So it's nothing that I've never heard of until I actually had it, right? So when you have a blood clot, and the longer, and this is the blood clot, this is the blood clot lecture I'm going to give you all. If you think you have a blood clot, do not delay getting diagnosed or treat at all. I didn't know that I had a blood clot. We thought that mine was from over exercising. So I thought I actually had a cyst behind my knee because I literally was walking 2 to 3 miles every day. I was riding, going to the gym 3 to 4 times a week, either doing the elliptical or riding the bike. I was hiking, swimming, very, very active. So I was not the typical blood clot person that you would think of. So I delayed again. This is where the medicine's teaching me not to delay. I thought I had a cyst behind my knee. I was like, all right, well, I'll just wait till it really hurts and then I'll go get it taken care of. Not smart. You really got it. When you notice something is wrong, the smart body is giving you messages all the time. Listen, this was another lesson for me, and I'm not going to say that I failed, but I could have done better. So the delay of me treating my blood clot because I thought it was a cyst, I now have post-thrombotic syndrome, and that's because the valves in my veins are now damaged. So if as nurses or medical professionals, you know that veins bring blood back up to the heart. And when you have your big popliteal vein, you have a valve that just opens and closes. Well, my valves are going like this. So I'm have blood regurgitation back into my leg, causing a significant amount of pain. So healing is not linear. I'm on another healing journey, but at least I have a toolkit that I can utilize. Cannabinoids, I use CBD, I use a little bit of THC, not very much THC. Too much THC for me actually makes my pain worse. So more CBD. And then I'm also microdosing psilocybin currently now to help with pain. And then I'm looking into this trial. So that's pretty much my story. At Holistic Caring and the Green Nurse, we've created an introduction to psychedelics course for continuing education credits for nurses. We help educate, guide, and support those who are exploring psychedelics. We also coach and consult on microdosing psilocybin and refer out to those who want to do a deep dive journey. And in our network, uh, we have a free network where we have a couple of free courses as well as a free plant medicine support group. So for me, one of the things that I've learned that is really, really important is integration is ongoing. And when we talk about integrative work, integration needs to start the minute you think about doing psychedelics. You need to think about how you're going to integrate this experience and the experiences that unfold into your life all of the time. And integration looks like what? It looks like lifestyle as medicine, right? Really having specific tools that you can use that are going to improve, support, and nourish your endocannabinoid system, your mind, body, and spirit. So you can get the most out of these psychedelic medicines that are here to help us evolve, grow, and thrive. And so that's my story.
Wow. Thank you for taking us on such a journey. That was a lifetime of experiences you've shared with us. I have a
Yeah,
few questions to go
absolutely.
along with what you've said. And the first question is, have you had any challenges integrating your psychedelic experiences and perspectives with traditional nursing practices and traditional, the traditional healthcare system?
Yeah, I'll tell you what integration is, and I'll give you a story about integration, and then I'll talk about the conventional system. The conventional system still sees these drugs as abuse. I mean, they just do. Even today, I go onto the American Medical Association website every day to see if they're going to change their mind on cannabis, and they don't. They still see it as a drug of abuse. They only are approving FDA approved medicines. They don't see the botanical path or the natural herbal path as being a path that they will recommend to patients. And that's even now. But nurses, on the other hand, nurses, cannabis nursing is a specialty. So American Nurses Association, which represents 5 million nurses, actually just recognize cannabis nursing as a specialty, which is great, although doctors don't. But when it comes to integration, I'm gonna tell you that I did have, specifically when I did DMT, I had a hard time integrating that experience because it was so profound and so prolific. I experienced, and I'm sure, for those that have experienced DMT, I did the Bufo, the 5-MeO DMT, and I experienced pure consciousness without a body. And that was very, very intense, very amazing, absolutely wonderful. But once I came back, it was hard to be back. I'm not gonna lie. It was hard to be back. It was hard to be back in my body. I really enjoyed being a little flit of light, surfing the universe, in this quantum space. But I had to get back into my body. And so what ended up happening for a good week was every single time that I meditated, and this is why having integration and having someone that you work with is so important. Every time that I went into a meditation, I was out of my body for a week. And it was weird. I remember going out, and it was early in the morning. I had an appointment. I went and there was a long line, and so I sat down and I decided to close my eyes to meditate in a coffee shop while I was waiting for my coffee. And I literally, when I opened up my eyes, I didn't know where I was. And it was very startling. So it was no meditation out in public. So it was really interesting as to how and why almost like I was, what do you call it? Astral traveling in real time, in my waking life. It was very, very interesting. And that was hard to integrate. And so I had to spend a lot of time doing a lot of grounding work, a lot of earthing and grounding and somatic body work to stay in my body because it's easy for me to, that's probably one of the things is I really enjoy meditating. And so meditation to me is a wonderful way of integrating, I hopped out of my body. So the integration experience for that, I needed to do more things where I was awake and in my body and feeling my body. As far as integrating it into conventional care, I don't think they're ready for it. So, I got to tell you, I got, I've been challenging the system for a while now. And even my own doctor, when moving from Massachusetts to California and finally setting up a primary care doctor here, it was very interesting just to look at my medical list of problems that is like this long. And then she's like, well, you have all these medications, are you taking them? And I said, no. Well, how are you managing them? And so, I had to tell her. And then what ended up happening was they ended up slapping and I had to fight for it and I got it removed. Synthetic cannabinoid abuse. I don't take synthetics. I take the real thing. I go, who's kidding who? I don't want to. If I wanted to take synthetics, I would just go to CVS and go to the pharmacy. No, I'm using real organic whole plant medicine, nothing synthetic. So there is a huge, huge learning curve. But I will tell you, my psychiatrist and my cognitive behavioral therapist were in favor of psychedelics. They didn't understand it, they didn't teach it, they didn't learn it, they didn't know it, but they saw me get better and they saw me change and grow and adapt, right? And so they just said, whatever you're doing is working, but don't forget about the other stuff. And the other stuff is lifestyle as medicine. So that's oftentimes what happens when I'm working with patients and they're utilizing psychedelics, they're utilizing plant medicines, and and they want to change their life. It's not just about one thing, it's about a multimodal and using multiple modalities to help you live your best life. But oftentimes what happens is people get lazy. And trust me, I've gotten lazy at times as well, and you forget about that other stuff because it's so much easier just to grab for the CBD or grab for the microdose or whatever. But you really need to use these medicines intentionally and thoughtfully, and then you're going to have a much better outcome. So it's really self-dialoguing with self. Um,
Have you
before
encountered any challenges with workplaces or regulatory boards involving psychedelics or plant medicines?
I'll tell you, not with psychedelics, but with cannabis. This is a really good story, and I did a blog on this on Ask the Green Nurse Substack. Um, when I took care of my first hospice patient as a cannabis nurse, I blogged about the experience because it was so beautiful. And it was an amazing experience. And I didn't disclose anything about him, where he lived, who he was. There was no HIPAA violation whatsoever. Well, someone shared that blog, and this was back before the NCSBN came out with their guidelines, and this was before cannabis nursing was recognized as a specialty. I got pulled before the Board of Nursing in Massachusetts. They called me up and they wanted to know I was why was I bringing cannabis and talking about cannabis to a hospice patient at the end of life? And the story, and I said, well, if you read the blog, you'll know that that's not what happened. What happened was I got called by hospice, social worker, nurse, and the patient's sister who got a donation of full extract cannabis oil. And they wanted me there to educate them on the oil and watch him take his first dose. So literally hands off, sat there and watched him take it. And so it was this man who only had weeks to live. And he really wanted to spend time with his friends and family at the end of life. He was on 100 milligrams of morphine and it wasn't working. And so I taught him how to use this oil, but I didn't touch the oil. It was hands off. It was already at the house. I just brought education and I just brought myself and just being there and held space for him so he could feel safe taking it. And it was just a beautiful experience to see the transformation of this man that was all, contracted and shut down and couldn't look at me, to all of a sudden he's sitting up and looking at me and he wants a drink of water and he wants a can of Inshore, so beautiful story, shared about that. And they called me and they basically said, and the National Council State Boards of Nursing wasn't out yet. So they basically called me and said, what gives you the right to do that? And I said, well, what do you know about the endocannabinoid system? I said, this is the master regulatory system. I said, you guys need to get with the program. I kind of pretty much rehearsed and recited what the 70-year-old nurse told me. I said, listen, cannabis has been around for thousands of years and we have an endocannabinoid system and you guys need to get with the program. And, what makes you think I'm not qualified to teach on this? I said, that was number one. And then, and so then I provided them what I needed to do was I needed to prove myself that I was again doing what I said I did. So of course the hospice wrote a letter, the sister wrote a letter. I had to provide all of my nursing educational CEUs. I had to provide a bio, a resume, my work history, and I did all of that. And, at one point in time, they were going to take me to trial. And I said, you know what? I'm open to this. If you guys really think you have something on me, go for it. Bring me to trial. I'm going to bring my podcast team and we're going to record this whole thing and we're going to televise it. Because if you're going to make an example out of me, I want to show everyone else what you don't know. And this is the shame. This is the crime. The crime is you don't know what you don't know and you don't know that you don't know it. And here you are trying to punish me for relieving suffering and just holding space for a patient and the family. And that's what nurses do. We are the most trusted profession for 23 years in a row. And gosh, if someone asks me to hold space for them while they take a medicine that's going to maybe improve their quality of life when they only have a couple of weeks to live, I'm going to do it. And so
It
I
took a
dare you
lot
to
of
try to take my
courage.
license away. And they didn't take it away. But it was scary. I'm not going to lie. It was very challenging.
Wow. And I'm sure that was drawn out over a very long period of
It was
time.
a year. It
Yeah.
was a year.
Wow. Well, thank
Yep.
you for standing up for your patient and continuing to provide great care, even in the face of fear. You know, that they throw the fear at you and you have to stand on your ground and your knowledge. So good job.
Yeah.
I have some more questions. So, where you mentioned that a lot of medical organizations still consider psychedelics a drug of abuse. So where do you find information to support, your businesses, or how do you learn about psychedelics in a way that's accurate? And that's really my curiosity.
Oh, so where I've actually learned, I cannot say the man's name, but the man that actually um, guided me on my private journeys, he is an acupuncturist and he's traveled the world and he's traveled in with his wife and they've traveled to multiple different countries and they've learned from the indigenous. So I've actually learned from him. Um, Ceremony. I learned a lot of research, a lot of books that I've read, but working with the practitioner that actually sat with me and gave me the medicine, spent hours with him, like lots of hours with him, learning from him, um, and learning the different roles too, the different roles of what does it mean to be the medicine giver, because if you think about psychedelics, there's so many different ways that you can experience them, and they're all unique opportunities for people to grow and learn, and everyone's going to have their own personal preference. Some people might want to do a clinical trial, to experience psychedelics. Some people might want to do psychedelic assisted therapy, where it's very different. Some people might want to do it in a small group with a facilitator. Some people might want to do it at a rave. I don't encourage that for the first time ever. I don't encourage that at all. I see these as very sacred medicines. And so um, I just lost my train of thought.
Where you get your information.
Where do I get my information? So I get my information from research. So we do a lot of research. So a lot of research uh, so we're presenting next week at Empowered Endings, and we're presenting on psychedelics at the end of life. So we're presenting a lot of research, so clinical studies, that so it's just basically doing research. And then I've also learned from the person that actually served me the medicine, the person that served me the psilocybin, that served me the DMT, that served me the ayahuasca, and I learned all from him and spent a significant amount of time at his place, um, learning. Um, and then just from others.
Awesome. Do you have any advice for healthcare professionals or pre-healthcare professionals or anybody that wants to learn more, or maybe some resources for people who are just now starting to hear about psychedelics, or maybe are scared about psychedelics, or don't know anything about psychedelics?
Yeah, so we actually do have an intro course. We have an introductory to psychedelics that goes over the main psychedelics. It goes over the nursing role. We have about a dozen case studies of people that have volunteered to disclose their experiences, talking about integration and also talking about cannabinoids as facilitators for the psychedelic experience. We include that in our program. How, CBD can help, diminish the experience. THC can enhance the experience. When you're working with the 5-HT2A receptor, THC actually primes it, so just basically, we have a program. We also have like again, a plant medicine support group. I think integration is clearly fundamental for consumers and people, and having a place, because you can't undo or unsee what you see and what you learn and what you experience, and having a safe place to go where people can share and say, "Oh yeah, I experienced that too," and then how you got through a challenging moment and sharing those moments is very important as well. Um, we have a podcast that we've interviewed a lot of different people. Um,
Where can we find your program and your podcast?
the program is at holisticcaring.com. And we have a tab under, if it says patients and providers, and you'll see it says psychedelics. It opens right up. We do coaching. We do coaching and consulting for those that are interested in learning about it, because it's not for everyone. That's for sure. And and the bottom line is patients that, because the psychedelics is the new rave and craze, and a lot of times patients that book with us for coaching and consulting, it's like it's not, they don't even need psychedelics. They need CBD. Seriously. Um, to start, they need to get into the relaxation response and not trip. Tripping is definitely something that is not for everyone. You can't, you know what I mean? Like you have to have the tools and the resources to be able to integrate those experiences and to come out on the other side reaching your goals and the things that you're looking to, when you set your intentions for what, you want to experience, it may not always happen that way. You never know. A lot of times it's a gamble when you ingest psychedelics as to what you're going to experience. You don't know. And so to have a safe space for people to come and to integrate and to learn and to share and to realize that they're not alone and that they're on a journey. And this journey is magnificent. Even it can be scary at times.
Very cool. Well, thank you so much for sharing. Do you have any final words for us or anything else that you'd like to share?
No, I would say, if you're new to psychedelics, I would explore some of the other ones, some of the don't take a don't I would not go straight onto deep diving right away, like, doing a big giant journey. I would figure out, do some journaling and some prompting and watching podcasts and listening to people and to figure out why it is you want to do it. Like there's reason why you want to explore your consciousness and for healing. And so to take that time to really get to know who you are and why you want to do it. The why is just as important as is doing it, and having the experience. So, and that will help to clear up. And a lot of times too, patients that come to us that want to be educated on psychedelics, again, like I said, they just need to get into the relaxation response. They're looking for something. They don't know how to process information. Emotional processing is probably the most difficult things. One of the most difficult things we have to do as human beings is process emotions. No, we weren't born with a playbook on how to do it, right? And so emotional processing is ongoing. It's a lifelong journey, and you want to do it in a way that's going to be helpful to you and to others, right? Because your experience also can have a profound effect on other people in your life as well.
Very well spoken. Thank you so much, Sherri. Sherri's an active member with the International Association of Psychedelic Nursing, and she's a big part of plant medicine community. So we really appreciate her work and everything that she contributes. She's just an amazing person as well. Thank you for joining us on Nurse Stories Live. We will continue this series and see you guys next time.